everybody. This is Dr. Priscilla Bowens. We're here with our second episode. So glad you could join us on MD plus D.V.M, where we combine human health and animal health for one health discussion. So I'm here with my co-host, Dr. Kim. Dr. Kim, how are you doing today?
I'm good, but Dr. Priscilla, you look cute. Now you look cute. I will say that. But what is really going on? What's going on?
Well,
back from Target.
Yes. So I don't know if you've heard, but the numbers in Texas as well as other states have risen quite significantly for COVID-19. Have you heard about that all the way in Missouri?
So here we go. In the last 2 weeks, y'all, we have had a gangbusters of COVID cases in the United States. Just July 3rd. So it's the 5th of July, July 3rd, we had 57,000 cases in the United States. Yesterday kind of slowed down, 52,000, but that's a lot of cases. And it's not because we're testing more, it's because we're transmitting it more. So yes, what Dr. Priscilla has on her face, a mask, is a must. And I happens to have a really cute little head shield on too. It's adorable. I love the color. Oh,
Thank you. Thank you. Nice. And we're not recommending that you go out and get a face shield per se if you already have a mask. This is actually commonly worn more so by health professionals. So actually my husband, who is trained in neurology and neurosurgery, he actually wears that at work, so that's good for him to have, but he also wears that in addition to his mask. So we strongly encourage that of the mask wearing, and we want to remind everybody that although we came on and we smiled a little bit, this is a very serious issue. And while some people may say, Dr. Kim, well, the death rates aren't going up with COVID, what's so important about the number of infections and people going to the hospital as a human physician?
So the problem is they're absolutely right. The death rates are not going up. We are able to treat this disease much better than we were a few months ago. There's medications out there that are helping treat it. However, the hospitalizations are going up. So we're running into where, like down in Texas, you have the Houston Medical Center that's running out of ICU beds. You have, locations in Florida that are running out of ICU beds. And so the worry is that you're putting a strain on the health system, and you're going to have to make a choice between patient A and patient B. Patient B might have to be in a hallway or might have to be in a makeshift hospital because we've run out of beds. So that's the problem. And then the other problems, the other health problems that come, heart attacks, strokes, those things don't stop because a pandemic starts.
Right.
So we have those patients coming in as well. So the hospitals become overwhelmed with volume, and there's the problem. There's the real problem. So people are right. The death rate it's much higher than the flu, much higher than the flu. It's 10 times higher, but it is not like what SARS or anything like that. But it's concerning. So the reason why we are talking about this is because there's a study out there, and there's a few studies out there that looked at transmission and how people get it, indoor, outdoor, and we are in summertime, which is good. And being outside has been shown to be a much lower transmission rate. So if you're outside, getting a walking your dog, I don't think you walk your cat, but walk your dog and animals. So if you're outside, the rate of transmission is much, much lower. So that's what we want to talk about today, is getting outside, and then the common things that you might encounter being outside in these summer months. So go ahead.
That brings us to today, to our discussion today. And just before we get started, everybody, so if you don't know already, while I'm a licensed veterinarian, I am also a licensed attorney. So I have to make sure that we give our official disclaimer that what we are discussing today, Dr. Kim is a human physician, a human neurologist. I am a doctor of veterinary medicine, also a public health professional with my master's of public health. But these opinions are our own and do not reflect any of our employers. And if you do have any emergencies, of course, call 911.
Right.
Or go to your nearest human or animal emergency room. And so we are happy to share with you our opinions, but we have to make that disclaimer before we go any further. So with that said, I will go ahead, Dr. Kim, and bring up our PowerPoint that will discuss today's topic about bugs.
About bugs, and namely ticks. Yikes.
Yes.
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 Oh my. Yes.
Oh
ticks.
my. Yes.
Oh my. And those little varmints are everywhere. So we're going to talk about that, and Dr. Priscilla is going to bring that up. These animals or little insects, I guess, are carriers of pretty common diseases that a lot of people know about. Rocky spotted mountain fever, and then Lyme disease. A lot of people know about Lyme disease. So we're going to kind of break down transmission, we're going to break down prevention, and we're going to break down those two common diseases that people encounter. And then just to kind of give you guys some general information that's good coming in these summer months, because again, getting outside is what we really want you all to focus on in these next few months.
Yeah, that was perfect. So we went over COVID-19. We talked about why that is very much still a thing for people wondering. And then we talked about why do we care? Dr. Kim said, why do we care about this? We want you guys to get outside. So we're going to go over common problems, common diseases that you see with ticks and out in the grass, whether you're just walking in your backyard, right, taking your pet out for a walk, you may be near some brush, or you're going hiking and having fun. And then we're going to talk about those different things that Dr. Kim says, prevention. And if you have questions, we want you to ask those questions. Please submit them into the comment box. If you're logged in on YouTube, you have the opportunity to submit those questions. And we want to hear from you. We want to hear from our viewers so we can answer those important questions that you have. So let's go right ahead and dig in.
Okay. So with tick-borne illness. So let's just give some examples. So this tick right here and those pictures right there. So this tick right here, Dr. Priscilla, tell us what this is.
So this is very likely an American dog tick. And this was actually pulled off of a family member of ours. Dr. Kim and I are cousins. This was actually pulled off of a family member, and it looks really, really gross, which they, for most people they are. But this is an actual tick that was pulled off of a human that likely crawled off of a dog first. So we wanted to show you an actual photo of a tick in a bag, and we'll talk more about why this tick was in a bag later.
And I'll give you another example. I have a 3 and a 5-year-old, and my 3-year-old was eating breakfast one morning. And we were, getting ready for school. I'm doing hair, as many of us do in the morning. And I pulled back her hair and I saw this thing behind her ear. And I thought, she doesn't have a mole there. Oh my, that's a tick. Inside, I screamed because, of course, I can't scream outside because I have a 3 and a 5-year-old. So I screamed a little bit on the inside and thought, dear God in heaven, what am I going to do? And this is the reason why I keep a pair of tweezers downstairs now and upstairs. So I know exactly where the tweezers are, and I removed the tick and, but yeah, it can be very dramatic when you find it, if you're not expecting to find it.
Yes, very unsettling, especially when you're in your house and trying to be calm, and you may be getting ready to have a meal, and then all of a sudden somebody feels something that, looks like a skin tag or something like that. So we're going to go into want to show you some early photos that we're going to come back to. Dr. Kim is going to go over this. This is a very important point that she's about to make. So we go in advance.
Okay, so what this is here is a picture of a bullseye rash. And so this rash is something that happens with Lyme disease. And what can be interesting is that you notice that this is on a lighter skinned person. And you can definitely see the red. It looks like a bullseye. And it's something that normally appears about 2 to 3 days after you've had the tick bite. It can appear where the tick bite was, and it also can appear in other parts of your body as well. So, but I want you to notice that what this looks like, and then in the next slide, you'll see the difference. So the difference is, you see how subtle and how different this looks on brown skin. So it's very important that you do the tick checks and you know that you've been bitten by a tick or had a tick on you, because you see how much different this bullseye rash looks on brown skin versus lighter skin. So we want you all to be aware that even though you might be looking for this bullseye rash, if you're of a different skin tone, it might look very different. So that's one of the signs of a tick bite. And in some cases, some patients never see the tick. They didn't realize they even had a tick on them, and then they get this random rash. But they get all the other symptoms that we're going to kind of go through in addition to that.
Right. Thank you for that. So one important thing we're going to talk about, where do you find ticks? Because some people watching this may be in Florida, California, Michigan, Texas, you know, and the common carrier for Lyme disease, which is one of many tick-borne diseases, is called Ixodes scapularis, or it's the black-legged tick, excuse me. So where can you find this? And as you can see on the map here, this is over half of the contiguous 48 states in the US. This tick is everywhere, just about. And then you also have to think about current day travel with people moving around so much, and ticks can kind of hitchhike along. They have several pairs of legs. So, you know, you may think that maybe it's over in Pennsylvania where I've seen Lyme disease when I lived there and practiced there, but it could move over to California if somebody gets on a plane and goes over there to travel. So one other important note is that we have other types of ticks, not just the black-legged tick. Here's an example of where the brown dog tick is located. This is called Rhizocephalus sanguinis. And this is likely the tick that we initially showed at the beginning of the episode. So ticks are everywhere. So don't think that, you know, just because you live in a certain climate, you won't find them. And don't necessarily think that it's a seasonal thing as well, because unless there's a hard freeze, you can find ticks all over the United States. Is that right, Dr. Kim?
Absolutely. And that's the key, is that even though it's much more common to happen in the summer months, if, like she said, if you don't have a hard freeze, those ticks are still alive. And it's interesting that you see them, all these different species of ticks, all these different types of diseases that can happen. The two most common ones we're going to talk about, but it's all over the place. And it's a common issue that people don't even really think about until they run into it, until it happens.
Right, exactly. And just to reiterate, everybody, why are we talking about tick-borne disease? We want you to get outside. Being outdoors is safer when it comes to COVID-19 and its transmission. And not only that, is that tick-borne disease is the most leading cause of tick-borne illness in the United States. It's the most widely reported. So this is not just something that we're making up. This is one of the most common tick-borne diseases. So we want you to be aware. And with that, we're going to go into, once again, we show a picture of a tick because we want everybody to know how it looks. And if you can see Dr. Kim's face, so it could be, that can kind of be kind of scary. So I actually will tell a quick story. Practicing in a hospital, we had a pet that was likely an outdoor dog, didn't come inside much, and I believe it was rescued, which was awesome that someone rescued. But they brought the pet in, and they said it had ticks, and you couldn't necessarily see all of them, but just a few. So what we did was we treated the pet. I believe it was with topical parasitic and anti-parasitic. And once we treated that pet, you could see the ticks start to drop off of the dog in the cage. And I know that's for some people that may be making your skin crawl, but all these ticks that were nice and plump, yes, and they were filled with blood, because that's what ticks do. They have to, in order to advance through several stages of their lives, they go from egg to larva to nymph to adult. And so they have to, in order to advance through their different stages, they have to have a blood meal during each stage. And so that's why they get on different hosts. And we'll go to the next slide. So here we are. We're going to talk about mainly one, but there are two commonly known diseases that result from an infection. If a tick latches on, that you could probably get, you or your pet. And one of the first ones, and the main one that we're going to talk about today, is Lyme disease. But just as we said earlier, there are all kinds of tick-borne diseases, including Rocky Mountain spotted fever and some additional ones like Ehrlichia. And we're going to go into what Lyme disease is. Did you want to start off with that, Dr. Kim?
Sure. So I don't know if you wanted to go into the vector versus.
Yes.
Okay.
Yes. And we're going to pause the show and we'll go back into that.
Okay. So.
Okay. All right. So we're back. Just the two of us.
Just the two of us.
I'm sorry, three.
Oh, just the three of us. Who's that over there? Hey there.
That is the Mr. Dr. Bowens. He is our resident veterinary neurology and neurosurgeon. So he's going to help us when it comes to tick-borne disease as well. So just to let you guys know, Lyme disease is caused by the bacteria Borrelia burgdorferi. Mm-hmm. But how does that get to a human or animal host like your dog? Well, it generally generally the tick takes a bite from a mouse or a deer. Right. In the wild, or in the community or in the forest. It generally takes a bite from an infected mouse or deer. And from that infected mouse or deer, that transmits the bacteria to the tick. And it's actually like a S squiggly kind of we call it a spirochete, but it's like an S-shaped bacteria. And that once that tick takes that blood meal and receives that, or gets the bacteria from the mouse or the deer host, it is called a vector. And what a vector is it is an organism that transmits disease. And what the next step for the tick is to take a bite from another host, because it has to go into the next stage of its life cycle. Right. And so that's when they get ready to kind of hang out on the brush as you're walking by, as your dog's walking by, and then it latches on. Ticks can't fly. they can't do any of that. Like mosquitoes, they just crawl on. Mm-hmm. And so that's when they take their next blood meal, whether it's on a person or on a pet, that's when you have the potential transmission of disease.
So the tick's sitting on the branch, sees you walking along, and says, "I'm about to jump in like double dutch."
Yes.
Get ready? And jumps on it. Okay.
Yes.
Now you got a tick on you. So let's talk about Lyme disease. For Lyme disease, there's about 30,000 cases of Lyme disease reported every year. It's a reportable disease. It's a treatable disease. And it can cause a lot of things. So what happens after you've found the tick, or you had a tick on you, a few days later, the early stages, which is like 2 to 3 days after you've had that tick on you, you'll have fever, chills, you can have a headache, you can have fatigue, you can have swollen lymph nodes. So like when you have a really bad flu-like illness or cold, your lymph nodes will be swollen. You can get that rash. 70 to 80% of people will get the bullseye rash. But I didn't say 100%. I said 70 to 80%. So some people will have a tick bite and then get all of those other symptoms, but not get the rash. It doesn't mean that you don't need to get tested, right? Then you have some of the later stages of Lyme disease. So say you don't get treated. So a few months or a month within from getting that actual bite, you can get symptoms like meningitis. So you can have neck stiffness. You can have Bell's palsy, which means one side, or in some rare cases, both sides of your face, upper and lower part of your face becomes like, it almost looks like you've had a stroke. But commonly strokes are the lower part of your body, but the lower part of your face, but the upper and lower part of your face will become paralyzed. You can have nerve pain. So like shooting, singeing nerve pain, paresthesias or numbness in your fingers and in your toes. You can have really large swollen joints that can happen. So it's one of those things that is when you see it, and I've seen it, you know exactly what this is. You have to test to prove it, but physical exam is really the way that you diagnose things like Lyme disease. So the symptoms, go ahead.
I was going to say that's interesting because in pets, usually we don't see a quick onset of symptoms, and it's not really an opportunity to see a bullseye per se, because you usually have quite a bit of fur in a way. So patients will present. I've not seen any cats ever really present for Lyme disease clinical signs, although a tick can transmit the bacteria to cats. They're not commonly found to have this disease, but generally you'll see this in dogs. Okay. And so with that, a pet will come in with fever, swollen joints, limping, swollen lymph nodes. We call that lymphadenopathy. Just generally lethargic. They don't, just not, we call it just ain't doing right sometimes. ADR, ain't doing right. They can be depressed. And the more extreme cases, like you're talking about the neurologic effects, more extreme cases are cases where the mortality rates are higher is when you have kidney involvement or renal disease. Okay. So those are the type of cases, but it's a general, that's those signs, the swollen joints that may kind of trigger other potential like immune mediated diseases in pets. But generally that's going to be your top differential when you see a dog come in with those types of clinical signs. But you really, there's really no way to immediately diagnose Lyme disease. There are antibody tests, but by the time you have something come back, and if you're suspecting this and based on the history from the owner, because again, our pet patients can't tell you what's going on, you probably will treat presumptively. So the symptoms and signs are a little bit different in pets, but there are some similarities. I will ask you though, when people come in, I mean, do you see a lot of these cases? Have you seen
Lyme?
Yeah.
So in my practice and in my patient population, I actually don't see the acute stages of Lyme disease. Because most of those patients are seen in the ER. They're admitted to like a inpatient medicine team. But what I have seen and what I do treat are those post-treatment Lyme disease syndromes. So those people who have the pain, the fatigue, the foggy thinking that can happen up to 6 months to a year after they've had Lyme disease. Even when it's been successfully treated with antibiotics, some people get this rare post-treatment Lyme disease. So I do have some patients that have lived in regions and they actually have antibody proven Lyme disease. They had it. And then they come back with these cognitive problems. They can't think, they have overwhelming fatigue, and they have neuropathic pain. And so that's another thing that I do see in my practice. So it's interesting because these patients have been treated.
Did you want to add anything from a neurologic perspective, Dr. Bowens?
As far as Lyme disease?
Yes.
I've been practicing now over 15 years, residency training, neurology and neurosurgery. We typically don't see Lyme disease causing neurologic symptoms. It's more so Rocky Mountain spotted fever or lichia. Those are the more common tick-borne diseases that can infiltrate the central nervous system, as Dr. Kim alluded to. So.
Cool. So cool to have the neurology people, human, animal. I feel very, very small. Brilliant people. So thank you for adding to that discussion. And so, so in veterinary medicine, we'll see the neurologic signs more commonly with Rocky Mountain spotted fever. So we want to get into what people know what the disease is. They've seen examples of what initial lesions can look like in humans. So, how can people, I think we're okay for people to ask, like, what can people do to prevent Lyme disease, or how do they identify ticks? I'm going to go ahead and pull up our slides again and start our slideshow and share that screen. Let's see. Okay. We're going to share this and we're going to go over how you can, one second. We're going to show these lesions again that Dr. Kim mentioned so you can identify this. And we're going to go over real quickly Not too fast, but we'll go over real quickly how to identify ticks, because we want you to be able to go outside and be safe. Can you see my screen?
Mm-hmm. Yes.
Great. So did you want to go over these lesions again, or do you want me to go to?
So again, these are considered common, these bullseye rashes. And rashes happen in a lot of tick-borne illnesses, Lyme disease, as well as Rocky Mountain spotted fever. So if you get a rash, specifically a bullseye rash like this, if you have lighter skin, it kind of comes out looking like this with the red rash and the big center bullseye. But on brown skin, this can look different. So that's why we have these examples of what it can look like on brown skin. And a lot of this information, actually, the vast majority of this information that we are giving, you can find on the CDC's website. The CDC does a really good job of talking about tick-borne illnesses, especially during this time of year. So now we're going to go into some of the hiding places that ticks can happen on animals and humans. So on humans, and where I found my daughter's tick is right there in and around the ear, around the hair, in the hair. I had a patient, or I didn't have a patient, I had a story of a patient where we treat this disease called Guillain-Barré. It's not common, but it happens enough that you treat it as a neurologist, and it causes people to become paralyzed. And it's called an ascending paralysis. It's very scary because it starts in their feet and it works its way up, and it basically paralyzes you from the feet all the way up. This patient presented with this, and they thought he had Guillain-Barré. They treated him for it, and it didn't work. And then finally, someone thought, could this be tick paralysis? And they found the tick in his hair. So in and around the hair, and once they pulled the tick off, he got better, which is great. In the underarm area, I know I've actually pulled a tick off someone in their underarm area, which is not the bomb. Inside the belly button, around the waist, in between your legs, like in the groin area, and behind the knees. That one picture of someone with brown skin, that was behind their knee. So those are places where ticks commonly hide on humans. Okay, and Dr. Priscilla is going to go with the pets.
Yes, we are. Dr. A. Bowens wanted to say something about, you want to say something about Guillain-Barré disease?
No, just about tick paralysis. That's just, it just basically shows you how the whole One Health model, as it relates to human medicine and veterinary medicine, we get the same thing in veterinary medicine. Dogs get tick paralysis, and just like you described, it's an ascending paralysis, basically where the tick's saliva releases a neurotoxin that prevents the release of acetylcholine, and so it blocks the receptors at the neuromuscular junction. So that's just it's amazing. And so once we find the tick and remove it, and basically we give the dog, I've seen most of the cases in dogs, I haven't seen any cats, but once we give them a flea or tick bath, in 24 to 48 hours, they're back to normal.
They're back to normal.
But it's the key is finding the tick. That's the key, and removing it.
Exactly. And so just, again, I'm just going to be the third person to say this, but it's so cool about, this is why we have these discussions, because human medicine, animal medicine, they're not really that far apart. As you can see, we talk about our early episodes are about zoonotic diseases, are diseases that can be transmitted from humans to animals or animals to humans. So it's really interesting to see these types of occurrences and to be able to discuss them as professionals. It's really, we're doing something that's revolutionary, groundbreaking. We have, you don't commonly find this type of discussion. So, but we all have to live on this planet. So we all need to talk about what affects every being and species among us. Now, what Dr. Kim said, she went over where you commonly have hiding spots in people. These are common areas that you may see in pets. And again, this is taken from the CDC. Here we have a beautiful Schnauzer. And so you just finished a walk with your dog in your neighborhood. I actually had a neighbor to ask me this very same question. But you finish the walk with your dog, you come home, you're just, petting your dog, and then you feel like this little bump that maybe you're like, okay, is this a skin tag? What is this? And so what you want to know is that when you come in, if you do tick checks for yourself, you want to do that for your dog too. You want to do this for your cat too, especially if they're an indoor-outdoor cat. So with the dog or with the pet, you want to look in places like around the ears. So ticks like to find areas where the hair is as thin as possible so they can insert their mouths into that area and they can suck blood. And they also want to find kind of a shaded area kind of out of the way so you won't find them. So that's why you need to go and look in these areas around the ears, around the eyelids. I've seen and pulled ticks from this area. Underneath the collar, that's one area where they will hide easily. And we'll talk about the fact that you can actually get tick collars that work very well. I highly suggest that you get this from your veterinarian as a prescribed medication, but you can see ticks around the collar as well. You also can see them under the front legs, between the toes. I've seen them there, the back legs, and around the tail, especially the base of the tail. They'll just be hiding in that area. And so if you do find, where are my tweezers? If you do find a tick, you don't want to just grab your fingers. You don't want to just look at it and say, ew. You want to get something. What'd you say?
I said, get that bad boy off of you.
Yes. The sooner that you get it off of yourself or your pet, the lower the chances are that you or your pet could be infected with a tick-borne disease. So Dr. Kim and I have some tools of the trade. What do you have, Dr. Kim? That looks actually kind of fancy.
Well, no, this is literally just.
See it? Let me take this down.
You can just tweeze like your eyebrows, but these are tweezers that have a good grip on them. And I mean, this is what I use to pull it off of her. So I could just grip it and grip that head and just yank that bad boy off. So that's what I did with it. Yeah.
And that's exactly what she said. So you definitely want to get as close to the head as possible. You don't want to do any turning or twisting because you don't want to leave anything in. No. Close to the head as possible and pull up. And if it's stuck in there, you may have to yank it really well.
Yeah.
You had to yank it, huh?
I had to yank that bit.
You had to yank it. Got to get it out of there. So, and what you do with it after that is you want to save it. See, Dr. Kim has a baggie there. And why do we need to save this? Why don't you just throw it out the window? Like, why do you need to save the tick?
So my mistake, because I was so grossed out that I had this tick on my child, is I threw it in the toilet. And I said, oh yeah, that was a tick. Too late. So it's gone. So what you want to do is you want to try your best. Now that you've gotten it off, you want to save it because you want to take it with you so they can test it to see if it has any of these illnesses. You want to make so you can monitor your loved one, and the physician or your veterinarian can monitor your loved one and make sure that they don't develop these diseases. So that's why you want to keep the tick if possible. Okay.
Yes, just like my family member sent me a picture of the tick in the baggie. That's the type of thing you want to do because a lot of states have free testing. If you're a resident of that state, I know the state of Texas has it, the state of Michigan has it. I'm sure it's like that in almost every state because actually Lyme disease, while they may not test your pet, the tick that you found on your pet, if it's found on a person and a person actually is diagnosed with Lyme disease, that's a reportable disease. Okay, this is something that state health agencies have to be informed of. So this is not just, oh, somebody has Lyme, that's, hopefully they'll feel better. This is something that we need to know about because we have to track the uptick in cases to know what's going on in our community. So you want to keep the tick, as gross as it might be, you want to keep it.
Yeah. So both diseases, Lyme disease and Rocky Mountain spotted fever, are reportable diseases. So we have to. That's the reason why they're so vigilant about knowing. That's why the CDC has a big section on Lyme disease and Rocky Spotted Mountain tick-borne illness in general. They have a big section on it because you want to know if that prevalence is getting higher and higher, which unfortunately, when you look at the numbers between 2012 and 2017, the number of cases has gotten higher, and they have a really great map that shows each reportable illness. And you can see the map getting darker and darker in certain areas where more and more people are getting diagnosed with Lyme disease. So it's out there.
Yes, it's out there. And so do you have to just go hiking to potentially come across ticks, Dr. Kim? Is that so? If somebody's like, oh, you know what? I have, a house and maybe a couple patches of grass or a little bit of a backyard, or I I just, I'm in an apartment in New York City. I maybe take my dog outside to go potty in the grass, or I mean, do these individuals, should they be vigilant as well?
I think so. I think they should, because ticks can be in trees. In my neighborhood, we're not necessarily in the, bustling city, but we are in a neighborhood that has small trees. They hang out in trees, they hang out in brush, they hang out in leaves, they hang out in areas where things could be just rustled up. They hang out in those areas. So they can be anywhere. You can find them in the desert. You can find them on hikes in the mountains of California. You can find them anywhere. So you need to be vigilant about doing tick checks if you're out and about, which I hope you do go out and about, but you just have to be vigilant about it.
I agree. And just so you can know, because I know we have viewers from around the world, there's tick-borne disease everywhere, in Europe, Asia, on the continent of Africa. So this is something that not only affects us here in the United States, but we want to look at this with a global perspective. Right. Because you may not have Lyme disease, but it could be another disease as well. Yeah. There are quite a few other vector-borne illnesses that are in the world: malaria, leishmania, trypanosoma, just all different types of diseases that are transmitted with vectors. And so we just want everybody to be vigilant about that, but we want to encourage you to go outdoors safely by yourself, with your pet or family members. Keep that social distance going so we can help reduce the transmission of COVID and prevent this surge and overwhelm our medical professionals like Dr. Kim. So with that, I mean, we really are encouraging questions. If anybody has questions, please submit those into our chat with YouTube. We'd love to interact with you. We want to just briefly go over mosquito-borne diseases. Now, a lot of people, if you don't live in the South or Southwest or other areas, you may say, mosquitoes, big deal. But actually, mosquito-borne illnesses have been found, or diseases have been found in all of the lower 48 here in the United States. And one of those diseases is that's commonly known, or it's actually the most commonly reported mosquito-borne disease, is West Nile virus. Yeah. And we want to just briefly bring that up because we're in the summer months. People, again, are going outside, and in Texas, it's hot. It's very hot. And people may be more inclined to go outside from dusk till dawn. Well, guess what else is out from dusk till dawn? Mosquitoes. Yeah. Mosquitoes. So you really want to be vigilant. This is with ticks too. Wearing your insect repellent, and unless you're precluded from wearing that by your doctor, you want to wear insect repellent when you're going outdoors. And why is West Nile such a really weird disease? And I'm sorry, Dr. Bowens. Oh, yes, there's a question. Oh, go ahead. We have a question.
So from one of our viewers, they said they love the information and they're curious if their dog is currently being on a flea and tick preventative and they find a tick on their dog or cat. Should they let the medication do its job in terms of the flea and tick collar, or should they just go ahead and remove the tick anyway?
So great question. That's a really great question, because it's not only, the question was about removing ticks from your pets, even if they're on flea and tick preventative. And I should have gone over that in even more detail. That's why we have questions. Thank you, viewers. So this is important because not only does it affect your pet, but it affects people too, because if the tick is on the pet and has not latched on yet and gets on to you or your family member, then we may have double trouble. Mm-hmm. So first of all, yes, another form of preventative is to have your dog, we'll talk about dogs right now, on a flea and tick preventative medicine. That may be a pill, that may be drops, and there's some great veterinary prescribed flea and tick collars that work really well. Okay. If you have that on there, and if it has not expired, the time that you're supposed to have it on the pet, some may be a month, a couple months, some tick collars are for 8 months. If that has not expired, a lot of those medications help to kill ticks before they attach and even after they attach. But if you see one on your pet, you still want to remove it because you don't know if the tick attached and it may be dead. They don't always loosen, right? Even when they're dead, they don't always loosen the grip. So you still want to remove it. We have our tweezers here. Don't use your hands, and then make sure you wash them after after you've removed the tick. But you want to take the tweezers and get, again, as close to the skin as possible and pull it out. Don't get bit by your kid or your dog.
Yeah.
But yes, just like how Dr. Kim is giving you an example, get as close to the skin as possible and pull that out and save it. But yes, great question. There's also a Lyme disease, Lyme vaccine for pets only, for dogs. Right. But there is none for, there is no vaccine for people, right, Dr. Kim?
No, that went off the market in 2002. So okay. No, there isn't.
So no vaccine for people, but there are some for pets of varying, some have one antibody, some have more antibodies. Highly recommend that you talk to your regular veterinarian. Sometimes it's a case-by-case basis. In Texas, it may be case-by-case, depending on how active your pet is. Hiking, hunting. Hunting is big here in Texas. And or maybe in the Virginia, Maryland area where they have a lot of deer, they may give Lyme vaccines to every dog that comes in. So it just depends. But yeah, very good question. There is prevention for pets. Use it. Have your pet on it year round. Another thing that helps to prevent is some of those medications help with mosquitoes as well. Because in the South, in the warmer climate, especially in the U.S., we have heartworm disease, which is transmitted by mosquitoes. And a lot of people say, well, my dog doesn't go outside. Well, mosquitoes come indoors. So I heard that over and over again. My dog doesn't go outside. Well, mosquitoes can come inside. So prevention, flea and tick and other insect prevention is so important because it helps not only prevent diseases with your pets that they can get from fleas, like with cats, they can get, is it feline mycoplasma? There's just a lot of disease. Yes. Pets can get tapeworms from fleas, and those tapeworms can be transmitted to your kid who is playing around the rear of the animal. So there's a whole bunch of really good reasons to keep your pet year round on flea and tick medication. Did you have anything to add, Dr.
No, I was going to
Bowens?
say, another big thing that dogs can get from mosquito bites is heartworm disease.
Yep.
So, and that's definitely extremely prevalent in the southern region in the United States. We have a second question.
We do?
Yes. Okay. So our second question is, with pets, is it okay to give an oral flea and tick preventative and still use a flea and tick collar?
So I would say talk to your regular veterinarian, okay? Because every case is different and every vet has seen, how certain medications work depending on the pet and the region. So I would definitely strongly recommend, if you don't have a regular veterinarian, to seek the advice of a regular veterinarian. But if you think your pet has been bitten by a tick and is showing signs, we talked about fever, lethargy, that's general tiredness, swollen lymph nodes. We may not be able to identify that readily, but if they're kind of lame and acting like they can't walk very well, and you know they may have been exposed to a tick, you may want to take them in.
What about as a preventative measure?
Preventative measure?
Yes.
Oh, just like I said, flea and tick collars, yeah. Strongly, unless your pet is allergic to it.
That along with the oral?
Oral, ask your veterinarian.
Yeah.
Yep.
Yeah.
Ask your regular vet.
And I would say, like, even for these diseases, while there might not be preventions for it, there are treatments for it for humans. And the treatment is a common antibiotic. It's a common penicillin antibiotic. And if you're allergic to penicillin, there's a secondary antibiotic that they can use in addition or in lieu of. So there are treatments for both. And the great thing is that it's the same antibiotic for Rocky Mountain spotted fever and Lyme disease. It's just a different time frame on how long you treat the patient, but there are common antibiotics that you can use to treat those patients. With West Nile, in the patients that I've seen who've actually had West Nile, the neurological manifestations are fascinating and devastating. They can have this thing called opsoclonus myoclonus, where their eyes do this weird thing. And I mean, you can't even mimic it. When you see it, you're just like, my God. And the person can feel their eyes jumping, and it almost makes them go, it's maddening. It's like a maddening type of syndrome that can happen after you get West Nile. You can get, of course, encephalitis, which is a inflammation in your brain that can cause you to go into a coma. It can be pretty devastating. So you want to be very vigilant if you start to have any type of manifestations of symptoms that are, outside of the itchiness of a regular mosquito bite. If you start to have neurological symptoms, headaches, neck stiffness, those things, type of things, you need to go straight to the ER and get checked.
Please. Yeah. And that's something, just to piggyback, I'll let Dr. Bowens discuss this as our resident vet neuro here. But in veterinary medicine, we generally don't see West Nile in dogs and cats. It's actually most prevalent in horses. So Texas, big horse state, It's very important that people get their horses vaccinated for West Nile virus, because you can see similar symptoms. So including fever, ataxia, which is incoordination. So you're a resident doctor, like you're in-house. Fever, ataxia, stumbling, hind limb weakness, depression, muscle tremors. Have you ever, I know you mostly do small animal neuro, have you ever seen any cases of West Nile in horses?
Yes.
Okay, can you speak to that? Because again, we don't commonly see this in dogs, but we're in a horse state. Florida's horse state. I mean, horses are everywhere, but big here in Texas. So you want to get those horses vaccinated for West Nile, because the mortality rate, the rate at which they die, can be pretty high. And then it also may be an indicator of West Nile being in the population where people can get it, because birds are generally the first host. Can you want to speak to that real quick?
Yes, I don't primarily deal with large animals anymore, but during my residency and also throughout vet school, we would see cases of West Nile affecting the equine species. Horses basically get, very similar symptoms that our human patients get, as far as, encephalopathies. And basically, those diseases are extremely hard to treat, not just because of the medication that's available. A lot of times when it's diagnosed in the horse, it's too far gone, and then it becomes human pet owners have a different value on dogs and cats in comparison to livestock or large animals.
Right.
So, but on the small animal side, for tick-borne diseases, as Dr. Kim alluded to, doxycycline for us is the drug of choice. A lot of times, if we even have a suspicion that they may have Lyme disease or Rocky Mountain spotted fever or Ehrlichia, other type of tick-borne diseases, once we get the samples that we need to send off for testing, we will go ahead and presumptively start these patients on a course of doxycycline, as well as other medications that help decrease inflammation and those type of things. So once again, there's a close correlation or some similarities between what our human patients get versus our patients on the veterinary side. And this is why we as a profession need to embrace this one health model and work together.
Right. And we are. So with that, we'll have our last question about mosquitoes. So are mosquitoes more prevalent at dusk or dawn? Are they generally around all day? I'll take that one. So they're prevalent at dusk and dawn. So when you're going into the evening hours, when the sun's starting to set, and between that time and when you're going into the morning when the sun rises, that's the most common activity for mosquitoes. So if you're going outside in the evenings, you're trying to get that evening workout in, or first thing in the morning before it gets too hot, you definitely need to make sure you have on your insect repellent if you're able to wear that. And you also want to make sure that you remove any standing water, after any heavy rains, any old tires, dog bowls that may be sitting outside that have standing water, because it doesn't take that long for mosquitoes to get around that water and lay eggs and start the whole process of breeding there. And we've seen that quite a bit in the area where I live, the metropolitan area where I live. So just a reminder that mosquitoes are out. This is the season. Please take care. And with that, I think we're going to get ready to close.
That's right.
Do you have any? Before we do that, we want to do shirts and shout outs.
All
so
right.
this is the thing that we do. Dr. Kim, you want to go first?
Okay. Oh, so my shirt.
Yes.
Everybody can see that. It's a nice young lady with her fist up. This is by an artist named Kababi Bayak. He's out in St. Louis, Missouri. He also did this great picture above my head right here. He and his wife also have a vegan bakery called Sweet Art. So he's a great artist. Every time we're in St. Louis, I try to get something from his art studio. And so he's just a great guy. So this was a really great t-shirt that I thought, oh, I'll just wear that. That's a good positive message.
I love that. I love that. Did you have any shout outs?
Well, I'll let you shout him out first.
Oh, okay. Okay.
I'm doing the shout out. I don't want
okay. So I have a shirt. I don't remember the artist or the individual who made this shirt, but I thought it was so cool. It has on it, be kind. Okay. And it's not just the words be kind, but it has it in sign language as well in different colors. You even have the one arm that has tattoos, and some people with jewelry, their nails painted, some not. And I just thought that was a really positive message right now, that we all need to, one, be kind to ourselves.
Yes.
Because we're going through a lot with the pandemic and with everything else that's going on. So be kind to yourself, give yourself a little bit of grace, and do the same for others. Yeah. It's not easy. I may look put together on YouTube, but I have to remind myself to be kind to myself and others. So do that. And with the shout out, we just want to say happy birthday to my father, Major Madison Jr. Hope you're okay with me saying your whole name on YouTube. But I want to give a happy birthday to my dad. He's a very seasoned young man. He's with my mom. So happy birthday, Dad. I hope you have a wonderful day. And we dedicate this episode to you. And before we go, we want to say thank you so much for joining us. And we will be doing this every 2 weeks. And Dr. Kim, what is our next episode going to be about?
It's going to be about nutrition and just preventative nutrition and how you can improve your health overall by using naturopathic things. So we're going to have some naturopathic experts for animals and for humans talking about, their journey to whole health, their journey to a natural way of being. And so we're going to do that. But then do we have a call to action?
We do have a call to action. Did you want to go through it with them real quick?
So number one, get out and be outside, do things outside, wear your repellent when you're out and do it safely, socially distance. If you can't socially distance, wear a mask, but get out and have, some activity. Number two, do a tick check when you come back in. Make sure that you're checking yourself behind the ears, all those different areas, and your animal. So do a tick check. Number three, if you find a tick, what do? You call your doctor, you call your MD, or you call your D.V.M. and get what the next plan of action is. How do you get that tick off? Use some tweezers. Don't pull out lighters, people. Don't do that. Use some tweezers to get it, okay? And that's really it. So that's our call to action.
Yes. That's perfect. So thank you guys for joining us. Please subscribe to our YouTube channel, MD plus D.V.M. You'll be seeing more content from us later. Thank you so much. And please, everybody, stay safe.
Please be safe.
Stay safe, please. Bye-bye. That's it.
Okay.
53 minutes and